washing my hands. Okay, how are you doing today?
I'm well.
My name is Logan Brown. I'm going to be your student nurse for today. We're just going to be getting some quick assessments on your cardio and your just a couple other things, musculoskeletal, some things, and it won't take us just a few minutes. Before we get started, though, can I get state your name and your date of birth?
Yes, Michael Coveroy, 5'6", 89".
Okay, looks good, Mr. Coveroy. All right, we're going to start with getting some lung sounds and stuff first. So I'm going to look at your chest. Everything looks good. No signs of barrel chest. Can you tell me if you have any tenderness or anything?
No.
No? Okay, no signs of crepitus. Everything looks good. So we're just going to go ahead and get some sounds real quick. Using the diaphragm. We'll start above the clavicle. Kind of breathe in and out for me. And just on the opposite side. Okay. Then we're going to swap to the intercostal spaces along the sternum. Okay, now get your shirt up for me. Okay. Okay, we'll go here to the mid-axillary line. And on this side. Okay, everything looks good. You can keep your shirt up. I'm going to check your back real quick. Okay. And on the other side. Okay, you can push your head. Everything looks good. No signs of cracking or wheezing or anything like that. So that'll be good. We'll jump on to your cardiovascular system real quick. We're going to be checking your three central. We're not going to be checking. We'll check your apical, but you have your carotid, your femoral, and your apical, which we'll be checking in a minute here. We'll go ahead and start with some of your distal pulses. If I can get your hand, we'll check your radial pulse. Good pulse, +2. And then here we are with the brachial pulse. Once again, good strong pulse, +2. Then we'll drop down here to the popliteal pulse behind the knee. And then down here on the foot where we have the dorsalis pedis pulse on top of the foot and the posterior lateralis pulse on this side of there. All that feels good though, nice strong pulses for everything. So
Awesome.
if I can get you to lay down real quick. Okay, so we're looking at the skin here, everything looks nice, warm to the touch on both sides. No signs of any abnormalities, everything looks good. Alright, if I can get you to lift your shirt real quick, we're gonna listen to your apical pulse. Okay, that looks good. About 72 beats per minute. And the apical is measured here at the mitral valve, which is on the 5th intercostal space on the mid-clavicular line. And so we're going to go up to the top now, and we'll get your apical pulse. Your aortic. Check your aortic valve. Once again, using the diaphragm. And everything is good. We'll swap over to the other side to get the pulmonic. Everything is good. And with those two, we're listening to the S2 heart sounds. And we'll go down here to the Erb's point. Once again, good. And now we'll listen to the tricuspid. And that is also good. And with the tricuspid and the apical, which we've already got, you're listening to the S1 sounds. So if I can get you to lay on your left side, you can leave your shirt up. All right, I'm gonna listen to your apical again, but we're gonna be listening for some S3 and S4 sounds, which we don't want to hear.
Okay.
Sounds good. No abnormalities there. Can't see them.
All right.
All right. If I can get you to lie on your back. We'll get your GI first now. So if I can, let me start with a question. When was your last bowel movement?
This morning.
Okay, this morning. And can you tell me a little about the consistency and the color? Everything normal?
It was a little bit lighter color, but consistency is about the same.
Okay.
Nice and soft.
Well, that's, as long as we're good consistency, we'll be okay. All right, well, we'll start with listening to some of your bowel sounds. If I can get you to lift your shirt. Start in your right lower quadrant. We're hearing clicks there. Major sites there is your appendix. Go to your right upper quadrant. Also clicks present. Major points, the liver. Your left upper quadrant. We have clicks there, active sounds. Listening there, stomach is in that region. And then here on the bottom, in the right lower quadrant, we also have clicks present with the designing colon and the sigmoid colon being there. Okay, so you can put your shirt down. well, let me check for tenderness real quick. You have any tenderness? Anything? No? Anything good? Coloration looks fine. No signs of masses. Can't feel any masses or anything like that. So all those look good. You can put your shirt down. Okay, so we're gonna go ahead and start with your musculoskeletal,
Okay.
if that's okay.
Yeah.
If I can get you to sit on the side of the bed. All right. Can you stick your arms out for me and flip them over, back over?
All right.
Okay, can you bend them for me? Up and down, shoulders up, all the way back down. Any hurt, any tenderness, anything like that?
No, difficult.
Okay. Can I get you to pick your legs up and your feet out and back in? Okay, looks good. Can I get you to move your neck around, make sure all that's good and loose? Okay, so no signs of pain or anything like that?
No, nothing like that.
Go around the joints real quick. We have no signs of inflammation. Everything feels good. All right, can I get you to stick your arms out real quick? Test your strength here, go up. Okay, and go back now. And come over here. Yeah, now go down. Very good. Looks nice and strong. Can I get you to do your legs the same way? Come up with them. All right. And back down. Okay. And can I get you to pick your feet back up for me and go out with them? Yes, and back in. Okay. Everything appears to be nice and strong. Everything looks in good order with that. Do you use any walking
No.
devices or canes, anything like
Nothing.
that? Okay. Do you have any difficulty with what you do on a daily basis as far as getting around?
No.
Okay. Well, that'll work good. All right. Can I get you to stand up real quick? And okay, can I get you to touch your toes or go as far as you can? Great. Stand back up and bend your torso. Bend the other way. Bend back a little bit. Any pain? Anything?
No, nothing like that.
Okay, can I get you to take a few steps that way? We're just going to be assessing his gait here, make sure everything's in line. All right, and come back this way. Everything looks good. All right, that'll be fine. You can sit back now. Everything looks good here. Didn't see any major abnormalities. So if you want to just get checked back up with your primary care doctor or anyone else, that'd be great. But what we have to do today is done, and everything looks good. So
Awesome. Thank you.
have a nice day.